The dining room inspection supports government legislation and home policies. It is conducted on every annual inspection, with inspectors making sure they observe the first meal after entering the home. Inspectors observe everyone, but tend to focus on the most dependent residents and whether these residents are positioned properly and served only when someone is available immediately to assist them. Staff interviews are conducted to determine how the dining rooms and other locations where residents eat are monitored, including in the resident rooms, and whether food and beverages for all residents' diets are accessible on a 24-hour basis, and how daily and weekly menus are communicated to residents. Inspectors often want to check training records to ensure that all direct care staff, volunteers, and students have received education on techniques used to assist with eating, including safe positioning of residents who require assistance. Inspectors need to ensure that comfortable chairs are available and that tables are at an appropriate height for eating, that staff are sitting at eye level when assisting residents to eat, that residents are monitored, including, as mentioned previously, residents who are eating in locations other than the dining room, such as in their rooms. Inspectors are looking to ensure that each resident is offered a choice in the planned menu items, that meals are served course by course, and that there is sufficient time provided for residents to eat at their own pace. They also determine how staff identify and meet residents' special dietary requirements, such as texture, allergies, intolerances, and preferences. On a side note here, homes are being asked to eliminate the use of publicly displayed table cards if they violate any legislation that protects personal health information. Inspectors are also looking for sanitary conditions. Do staff have any open areas on their skin? Are there any signs of infection or other indications of illness? Are staff practicing hand hygiene between residents after direct contact with residents' skin or secretions? Are residents offered an opportunity for hand hygiene prior to meal service? They watch for proper handling techniques, such as whether staff prevent the eating surfaces of plates from coming into contact with their clothing, whether staff are handling cups and glasses on the outside of the container. Are they handling cutlery by the handles? And are staff using proper hygienic practices, such as keeping their hands away from their hair and face when handling food? Inspectors are observing whether staff talk to residents rather than conducting social conversations with other staff. Do they respond to residents' requests in a timely manner? Do they provide meals to all residents at one table at the same time? Do they consider residents' wishes when it comes to using clothing protectors? Do they promote a relaxed environment? And do they speak with residents politely, respectfully, and communicate personal information in a way that maintains confidentiality? Inspectors determine whether there are institutional practices that may interfere with the quality of the resident's dining experience, such as meals served on trays in a dining room. Has the home attempted to provide medications at times and in a manner that does not distract from the dining experience of the resident, such as pain medications being given prior to meals so that meals can be eaten in comfort? Does the home avoid routine use of mealtime foods as a vehicle to administer medications? Inspectors observe staff response to a resident who refuses to go to the dining area or refuses specific meal items that are offered. If concerns are identified, the inspector will interview the resident to determine whether they were involved in choosing when to eat and where to eat, and whether the food offered takes into account the resident's food preferences. Inspectors will interview staff regarding the home's protocol to identify where and when a resident eats and how food preferences are identified and submitted to the dietary department. Inspectors also determine how staff identify and meet residents' special dietary requirements, such as allergies, intolerances, and preferences. During the meal service, inspectors determine whether staff are providing services to meet the resident's needs, such as cueing, prompting, or assisting a resident to eat in order to improve, maintain, or prevent the decline in eating habits, and how meals and assistance to eat is provided to those residents who wish to eat in their rooms. They're watching the assistance provided to residents who are dependent on staff. Are residents provided with any eating aids, personal assistance, and encouragement to support as much comfort and independence as possible? Are residents who require assistance with eating or drinking only served a meal when someone is available to provide the assistance? Do staff anticipate the residents' needs whenever possible? Inspectors also determine whether staff are providing services to meet the residents' needs, such as proper positioning in order to reduce the risk of aspiration and choking. This includes maintaining a 90-degree angle at the hips, knees, and ankles, supporting the resident's head in an upright position with chin tipped forward, and maximizing the resident's stability of the trunk of his body. Do staff ensure each resident does not slip forward or lean sideways or lean back in their chair, that their feet are supported solidly on the floor or footrest, that the resident is positioned close to the table with table level between waist and mid-chest? They will observe each table height to determine whether it provides the resident with easy visibility and access to food, and that every resident has eye contact with the person providing assistance who is seated at the same level. Inspectors will interview residents to hear what they have to say about the palatability or appearance of meals in the home. They will often request a test tray to assess any resident complaints, and they often check food temperature of a test meal by checking the temperature close to the time that the last resident in the dining room was served and began eating. Homes are frequently cited for the time delay between serving a dependent resident and having someone available to assist them with their meal. If concerns are identified with a resident who is not consuming their meal or has refused the meal that was served to them, inspectors determine whether staff attempt to determine the reasons for the refusal and offer a substitution. They will also interview staff in order to determine what is available for substitutes for the meal observed. For therapeutic diets, inspectors observe residents to ensure they are being served a therapeutic diet if that's what has been prescribed, and they review additional information that the dietary staff use to identify those residents in need of a therapeutic diet. Inspectors are looking at lighting levels, ventilation, room temperature, space, and furnishings. They specifically look at sound levels by considering whether residents or staff have to raise their voices to be heard, or whether residents can't be heard due to background noise. Do residents appear to have difficulty concentrating, possibly due to background noise? The dining experience is as much a social opportunity as it is an opportunity for nourishment. Success on both parts is largely influenced by the skill, observation, knowledge, and dedication of staff who are focused on the genuine provision of resident-centered care. Thanks for watching this presentation.